He was found dumped like trash on the desolate edge of an industrial wasteland, clinging precariously to life. His body was a brutal canvas illustrating the horrors he had endured. Deep puncture wounds, both fresh and old, riddled his muzzle, neck, chest, and legs, the unmistakable, devastating signature of dogfighting. Not the aggressor, clearly, but the victim. He was a bait dog, one of the countless sentient beings used and discarded by the depraved individuals involved in this barbaric blood sport. His ears were shredded, parts torn completely away. Scars, thick and puckered, crisscrossed his frame, telling silent stories of past agony. He was emaciated beneath the wounds, ribs starkly visible, his brindle coat dull and patchy. But perhaps worse than the shocking physical damage was the look in his eyes, a vacant, hollow stare that spoke of a spirit systematically brutalized, utterly broken, and devoid of hope. He lay, collapsed, too weak to stand, his breathing shallow, waiting simply for the end. This was not just neglect. It was the aftermath of sustained, intentional torture used to train other dogs to attack and kill. The call came from a concerned scrap metal collector who stumbled upon the dog, initially thinking him dead. Recognizing the likely connection to dogfighting, he immediately contacted Project Pitstop, a rescue organization renowned for its work rehabilitating victims of fighting rings and severe abuse, particularly focusing on pit bull-type dogs, like this one. Rescue coordinator Lena arrived quickly, her heart sinking at the familiar, horrific sight. This dog bore all the hallmarks of a bait animal, smaller or less assertive than fighting dogs, often used repeatedly to build the confidence and aggression of prized fighters, suffering grievous injuries with no veterinary care until they were too broken, too injured, or simply no longer useful, at which point they were typically killed or dumped to die slowly. Gently approaching, Lena could see the dog tense, a low, almost inaudible growl rumbling in his chest, but he lacked the strength to react further. His body was a landscape of pain. Fresh blood oozed from several deep punctures, while older wounds were clearly infected, swollen, and foul-smelling. He was terrifyingly thin, dehydrated, and shivering despite the mild temperature. Lena spoke softly, projecting calm she didn't entirely feel, her anger at the perpetrators simmering beneath her professional focus. "It's okay, boy," she murmured. "It's okay. We're going to help you now. Your fighting days are over." Carefully, with minimal handling to avoid causing further pain, Lena and her assistant managed to lift him onto a stretcher and transport him directly to their trusted veterinary partner, a clinic experienced in treating the complex injuries and trauma associated with fighting dogs. They decided to call him Champ, not because he had won any fights, but because they knew he would need the heart of a champion just to survive the immediate future. Dr. Miller's assessment was grim. Champ was in critical condition due to blood loss, severe infection, dehydration, and profound shock. Multiple wounds required immediate surgical attention: cleaning, debriding, dead tissue, stitching. Some older, deeper wounds showed signs of chronic infection, potentially involving bone. He was severely anemic and malnourished. X-rays revealed old, poorly healed fractures in his ribs and one leg, consistent with past trauma. His teeth were worn or broken, and underlying all the physical trauma was the certainty of immense psychological damage. Dogs used as bait endure constant terror, pain, and betrayal. They learn that other dogs mean agony, and humans facilitate or inflict that agony. Trust is a concept utterly alien to their experience. Dr. Miller warned Lena that survival was far from guaranteed. and even if he pulled through physically, the emotional rehabilitation would be a monumental undertaking. Champ spent the first week in intensive care, hovering between life and death. He underwent hours of surgery to repair the worst of his wounds. He received blood transfusions, aggressive IV fluid therapy, potent antibiotics, and strong pain management. He remained largely unresponsive, enduring the treatments with a stoicism likely born of long suffering. He barely acknowledged human presence, often flinching subtly if touched unexpectedly, even for gentle medical care. He refused food initially, requiring nutritional support via and later syringe feeding of a high-calorie liquid diet. But Champ possessed a spark, an ember of resilience buried deep beneath the trauma that refused to be extinguished. Against the odds, he slowly began to stabilize. His infections started to come under control. His body began, hesitantly, to accept nourishment. After about 10 days, he was able to stand, shakily, for brief periods. He started lapping water on his own. These small victories felt enormous to the veterinary team and Lena, who visited him daily, sitting quietly outside his kennel, letting him gradually acclimate to her calm presence. His incredible resilience was already evident. Most dogs in his condition wouldn't have survived the first 48 hours. Once medically stable enough, Champ was transferred to Project Pitstop's dedicated rehabilitation center. This wasn't a typical shelter. It was a quieter facility with experienced staff and volunteers trained specifically in handling dogs from severe trauma backgrounds. Champ was placed in a secure, comfortable kennel in a low-traffic area. The focus shifted from acute medical care to long-term physical healing and the monumental task of psychological rehabilitation. Initially, Champ remained deeply withdrawn and fearful. He spent most of his time huddled at the back of his kennel, avoiding eye contact. Loud noises or sudden movements sent him scrambling or freezing in terror. He showed extreme fear and reactivity towards other dogs, even just hearing them bark from a distance, associating their presence solely with pain and attack, a deeply ingrained response from his horrific past as a bait dog. Handling him remained challenging. He tolerated necessary care, but clearly derived no comfort from human touch, often flinching or stiffening defensively. Lena, along with a dedicated behavior specialist, Mark, began the slow, painstaking process of building trust and changing Champ's associations. Their approach was grounded in positive reinforcement, choice, and patience, respecting Champ's fear while gently pushing his boundaries in controlled ways. They started, much like Jenna with Tank, by simply being present near his kennel, associating their presence with quiet and eventually high-value treats tossed gently, demanding nothing in return. They learned his subtle stress signals, lip-licking, yawning, averting his gaze, body stiffness, and were careful never to push him over his threshold. Progress was measured in weeks and months, not days. It took nearly a month before Champ would reliably take a treat tossed into his kennel. While they were nearby, another month passed before he tentatively took a treat from Lena's outstretched hand through the kennel bars, snatching it quickly and retreating. Getting a leash on him seemed impossible initially. The mere sight triggered visible anxiety. They used gradual desensitization, pairing the sight of the leash, then touching him briefly with it, then clipping it on for a nanosecond, with incredibly high-value rewards. Simultaneously, they began working on his reactivity towards other dogs, using meticulous counter-conditioning and desensitization protocols. This involved exposing him to a very calm, stable helper dog from an extreme distance. Initially, perhaps just seeing the other dog across a large field, where Champ could remain below his reaction threshold. Any calm observation of the other dog was heavily rewarded. Slowly, over many months, the distance was decreased by tiny increments, always ensuring Champ remained calm and associating the sight of another dog with positive reinforcement. It was a slow, arduous process, requiring immense control and expertise to prevent negative experiences that could undo months of work. Throughout this incredibly challenging process, Champ's incredible resilience shone through. Despite his horrific past, despite the deep-seated fear, there was a part of him that seemed to want to connect, to trust. He started showing subtle signs of anticipating Lena and Mark's sessions, sometimes offering a soft whine or a tentative tail thump when they approached. He learned basic cues like sit and touch, using positive reinforcement, which helped build his confidence and gave him a predictable way to earn rewards and interact positively with humans. As the layers of fear began to peel back, glimpses of the dog beneath emerged. Champ revealed a surprisingly gentle, almost goofy side. He discovered the joy of soft bedding, often nesting meticulously before settling down with a contented sigh. He showed tentative interest in sturdy rubber toys, initially just sniffing them, then eventually picking them up, carrying them around, and learning to enjoy gentle games of fetch with Lena in a secure yard. He developed a deep fondness for gentle scratches under his chin and on his chest, leaning into the touch with closed eyes, a stark contrast to the dog who initially flinched at any contact. He still bore the physical scars of his past as a fighting bait dog, but his eyes began to lose their haunted, vacant look, replaced by a softer, more hopeful expression. Finding a suitable forever home for Champ was Project Pitstop's ultimate goal, but they knew it required an exceptionally special placement. He needed an adult-only home with experienced owners committed to positive reinforcement, capable of managing his potential triggers, providing ongoing structure and support, and understanding that he would always carry the legacy of his past. He could likely never be a dog park dog or live in a chaotic environment. The rescue screened applications with extreme rigor, prioritizing Champ's safety and long-term well-being above all else. They were prepared for him to remain in their care indefinitely if the perfect match didn't materialize. Then, after nearly 18 months of intensive rehabilitation, they found Sarah and Tom. This couple had previously adopted another rescued pit bull mix with behavioral challenges and successfully managed them through patience and positive training. They had no other pets, lived in a quiet area with a securely fenced yard, and were specifically looking for a dog like Champ, one who needed extra understanding and a peaceful environment to thrive. They were deeply moved by Champ's story of incredible resilience and undeterred by his past or his breed. The introduction process spanned several weeks, involving multiple meetings at the rescue center and eventually trial visits at Sarah and Tom's home. They followed Lena and Mark's guidance precisely, allowing Champ to set the pace, using established cues and management techniques, and focusing on building trust slowly. Champ was initially wary, sticking close to Lena, but he responded well to Sarah and Tom's calm confidence and clear communication. He seemed to sense their kindness and experience. It felt right. The transition to becoming a permanent family pet was carefully managed. Sarah and Tom maintained the predictable routines Champ thrived on. They continued his positive reinforcement training celebrated his successes, and managed his anxieties with patience and understanding. They learned his subtle cues, advocating for his space when necessary. They discovered his quirky personality traits, his love for snuggling under blankets, his funny habit of talking with soft groans and grumbles when happy, his surprising gentleness with even his toughest toys. Life for Champ now is a world away from the unimaginable cruelty and terror he endured as a fighting bait dog. He spends his days napping on plush dog beds, going for enjoyable sniffing adventures on quiet trails with his beloved humans, playing gentle games in his safe backyard, and soaking up the affection he was denied for so long. He greets Sarah and Tom with enthusiastic wiggles and happy tail wags, leaning his scarred head against them in moments of quiet connection. While encounters with unfamiliar dogs still require careful management and distance, he lives peacefully and happily as the cherished only dog in his family. Champ's story is a harrowing indictment of the barbarity of dogfighting, but it is ultimately one of incredible resilience and the transformative power of dedicated rescue and rehabilitation. From being left for dead, his body and spirit ravaged by his use as a bait dog, he has blossomed into a loving, trusting family pet. His journey underscores the potential hidden within even the most traumatized animals and the profound difference that patience, understanding, and unwavering commitment can make. Champ is living proof that even after enduring the worst humanity has to offer, the capacity to heal, trust, and love again can endure, offering hope and inspiration to rescuers and potential adopters everywhere.